Hi, my name is Phil Borders. I'm a psychiatrist here at Hendricks Therapy in Central Indiana. And today we're going to look at 6 studies of ketamine. And these are studies that I found to be legit. They were recent, and I thought they were all pretty interesting, at least interestingly enough to share. The first study came here recently, the summer of 2023, and it was a study conducted by Massachusetts General Hospital System, and that's basically Harvard. It was sponsored by the Cleveland Clinic. And the reason why it's sponsored, my guess is because, again, there's not any money to be made in ketamine studies because it is a medication that can't be patented. So we've got 2 research giants conducting this study. It was a study over a few years involving multiple patients, and it was a study that compared ketamine therapy with ECT. Now, ECT is electroconvulsive therapy. That's shock treatment. And they looked at how each of those treatments compared for those with bad depression. And shock treatment, it kind of freaks people out, but for the past 80 years or so, it is the gold standard. It has been the best treatment for people with really bad depression. So the results of these studies were pretty astounding. It showed that ketamine was, quote, non-inferior, unquote, to ECT. Now, I'm no statistician. I took it in undergrad. It was an 8 o'clock class. I had to go with my roommate. He didn't brush his teeth. His breath was just horrendous. So my statistics experience is, fairly negative. But I do know enough where, if you look at the study, it's like, wow. The fact that it was comparable to ECT is a little bit mind-blowing for people with really bad depression. So that was a pretty cool study. The second study came out of the Journal of Clinical Psychiatry in September of 2022. And this was of over 400 patients. And they looked at suicidality. And the results showed that just after 6 treatments, there was a decrease of 85% of those people who basically wanted to die or had serious thoughts of suicide. 85% decrease after just 6 treatments is pretty remarkable. The third study came out of Australia and New Zealand, where again they looked at suicidality, and they showed a modest decrease of suicidality, but just after 1 treatment. 1 treatment's not a whole lot, so a modest decrease after 1 treatment, that's pretty significant. The fourth study that I found interesting came out of the American Journal of Psychiatry, which is, another pretty legit journal, one that, a lot of psychiatrists will read. And they had 30 patients, and they looked at PTSD. And after, again, 6 treatments, it showed a 67% decrease in PTSD, which is a huge decrease, and again, after not that many treatments. And they were going to have 40 patients involved in the study, but they didn't find any reason to add the additional 10 because the study was so positive. They just kept it at 30. The fifth study came out of the Frontiers of Psychiatry, the journal of, I think it was March of 2023. And it looked at PTSD and ketamine. Now, what was interesting about this study was, as with the other studies, it showed a positive response to PTSD with ketamine treatment, but there was a negative response to ketamine if the stressor, the trauma, occurred a week or so before the ketamine treatment. So that leads us to think that maybe timing, and probably timing, is very important in ketamine treatment. Also, it's nice to once in a while read negative reviews, negative studies, because it just seems to add a little bit more legitimacy, because a lot of negative studies aren't published. So we know that ketamine isn't perfect, and the timing is very important. The sixth and final study came out of the March-April edition of the Harvard Review of Psychiatry. And instead of looking at depression and anxiety, because most people have severe depression have anxiety, they looked at anxiety and OCD without a connection to depression, without a connection to PTSD. And looking at these 9 studies, they found that they weren't really sure if ketamine was effective for just pure anxiety, for just pure OCD. Now, the importance of this is, not only, to kind of say, well, maybe we shouldn't just give it for anxiety and OCD, but also it's important to be able to read some negative studies, because negative studies are very important. A lot of times they're just not published. So the fact that they published a negative story, I think makes everything else a little bit more legit and gives a little more balance, because if something touts that it can cure everything, we need to be pretty skeptical of that. And this shows us that, we need to be a little more careful about what we're treating. And again, a negative study adds more legitimacy, I think, to positive studies, just because it's more balanced. So these are 6 studies. Again, I found pretty interesting and pretty relevant. Thank you for watching, and looking forward to seeing you at our next video.